So the results that I'm showing now at this conference are updated results after 18 months of follow-up, and they confirm the response rate. So there is still a confirmed response rate of more than 40%, and a median duration of response of more than 12 months. 58% of patients are alive after 1 year, and 37% of patients after 18 months. We see that some patients perform better than others. So we started to look into to perform some biomarker analysis in order to find out which patients do better than others. We have performed RNA sequencing on biopsies before treatment, and by doing that, we can distinguish the patients with the classical gene signatures and the ones with the basal-like phenotype. Usually, the ones with the classical gene signatures perform better, and that is what is seen in this trial as well. When we look to biomarkers more specifically, what we find is something that we theoretically thought as a as a mechanism of action for Mitazalimab. So we looked into the level of plasmablasts, and those are cells that secrete more antibodies than B cells, but less than plasma cells. They're still capable of internalizing antigens, and they present these antigens to T cells. And we see that patients with a higher level of plasmablasts on day 8 in the first cycle, so on the day that the chemotherapy is given for the first time, patients with a higher increase in these cells have a better survival. We also looked at CD54 monocytes, and these monocytes are precursors of macrophages and dendritic cells. They play a role in the innate immunity via cytokine production, phagocytosis, and antibody-dependent cell-mediated cytotoxicity. And again, patients with a higher level of these monocytes on day 8 and higher increase in these monocytes on day 8 perform better than the ones with a lower increase. And then we looked into a third cell type, the myeloid dendritic cells, the ones that internalize and present the antigens to the CD4 and the CD8 T cells. And they also, there again, we see that the patients with a higher increase of these dendritic cells on day 8 perform better than the ones with a lower increase. So all these biomarkers help us to distinguish patients that perform better from the ones that perform less, but they also confirm the mode of action that we thought Mitazalimab, by administering it around the chemotherapy, would have.